My name's Valerie Pickford and I'm the chair of the Nantwich Health Centre PPG, and I'd like to tell you a little bit about my views on the cluster groups. Prior to the cluster groups, we had the PPG Federation, which in the early days of its setup worked fine, but in the later months some of us felt that it didn't really work as it should. There wasn't a two-way street anymore for comments, it was more of a top-down enterprise. So we were pleased when the suggestion of the cluster groups came along, and we thought that we would try it at least for the first 12 months to see how things went. The cluster is an important link between the patient at each GP practice and the care community. Cluster members play an important role in helping the care community ensure that it makes use of the views of the patients, its insights and its experiences of those of the patients and of carers too. Any number of members from each of the 5 Nantwich and rural PPGs can attend the cluster group. It rotates around the practices, resulting in a change of chair for each meeting. This has worked well, allowing us to all feel involved in the cluster. There's no one PPG that actually predominates. 2 representatives from the PPG cluster have also been attending the Nantwich and Rural Steering Group meetings for the last 18 months. They meet about every 6 to 8 weeks. Attendance at the steering group also rotates around the cluster group members, so we've all had the opportunity to attend a steering group meeting, enabling everyone to learn about the bigger picture. The care community agenda also has a standard item on each meeting, which is about PPG updates, so that we can feed up our views on patient concerns, but that we can also report back on what they have asked us to look at. I'd like to tell you a little bit about what we've been involved with whilst the cluster groups have been going. We've reviewed new patient leaflets so that they are more patient friendly. We've been key partners in the production of a local car share scheme to enable patients who maybe have difficulties with transport to get to medical appointments more easily. We've been involved in the promotion of self-care within the community through the Self-Care Awards. Notice I'm a self-care champion. We've also been involved in helping with care community events such as COPD and diabetes, and there's one to come about dementia. Importantly, we've also been a partner around the table of the steering group when decisions and feedback are taking place.
Hi, I'm Natalie Sneed. I work in Nantwich and Rural Care Community and Primary Care Network supporting the practices. I work alongside the PPG Cluster Group for Nantwich and Rural on a number of projects. A number of projects that we've worked on in Nantwich and Rural are with the PPG Cluster leading are we're just hosting a patient transport scheme which they've been supporting with a member of our PPG being the chair. We've also looked at patient education events that they've helped facilitate on the day, so they've been sort of diabetes, COPD, we've invited patients along, and our newest project is the Self-Care Awards. So this is being led out by the PPG groups. They're going to be training schools, businesses, care homes, and we're going to be adding new modules to the self-care, so things around dementia, which is our priorities.